Students, we continue our discussion with Section 5 on adolescent health services. In our previous session, we mentioned adolescents. So I believe you are poised to go with me through adolescent health services. Adolescents constitute one of the aggregates or populations community health nurses work with. When we talk of adolescence, it refers to the transition period between childhood and adulthood. So you can see adolescents are people who come between children and adults. A school of thought contends that adolescence is characterized by enormous psychological and physical changes. Physical developments in adolescence are accompanied by psychosocial tasks, including a sense of identity and self-esteem, intimacy, and developing sexual activity. Sexual interests and sexual behaviors increase as adolescents enter puberty and achieve physiological sexual maturity. The period of adolescence represents one of the most rapid phases of human development, and it is fraught with many complex changes and challenges. Adolescents face a lot of changes that are so complex and challenging. Just as we said, people with disability constitute a vulnerable group, adolescents are also considered as a vulnerable group. The changes that occur in adolescence have health consequences, not only in adolescence, but over the life course. And this has implications for policy and programs. At the end of the session, students, you should be able to define adolescence. You should be able to describe developments in adolescents. You should be able to describe the peculiar problems of adolescence, some of which we have mentioned as problems of school-age children, because adolescents may also be in school, won't they? Adolescents may be found in school. So some of the problems we have discussed as health problems of school children are also problems adolescents encounter. Finally, you should be able to discuss the health services that are accessible to adolescents. So in this session, ladies and gentlemen, we are looking at adolescent health services. That's your reading list. Do refer to it and do a bit more reading than we have in the slides. And as I keep telling you time and again, the WHO website has many documents on adolescents. So it is important that you visit this website and read as many documents as you can find on adolescent health services. Adolescents refer to persons between the ages of 10 to 19 years. We have said adolescence is the period between childhood and adulthood. In terms of age, adolescents are considered as persons between 10 years and 19 years. Are you an adolescent? You have to answer it for yourself. Adolescents encounter many complex challenges, physical in nature, emotional, cognitive, and social. They face complex challenges in these areas of life. These challenges require rapid and major developmental adjustments, and this subjects them to many stresses and problems with an impact on their overall health and well-being. I must say that adolescence is a period characterized by specific health and developmental needs, as well as rights. The period of adolescence is a time to develop knowledge and skills, a time to learn to manage emotions and relationships, a time to acquire attributes and abilities that will be important for enjoying adolescent years and even to assume adult roles. Let's look at some statistics. About 1.2 million adolescents are found globally. 1.2 million adolescents are found globally, and adolescents are said to constitute 18% of the world's population. In sub-Saharan Africa, adolescents form 23% of the population, and in Ghana, they form 23% of the population. Morbidity. I believe you all know morbidity refers to illness or disease. Sexual and reproductive health problems, including sexually transmitted infections and HIV, are problems of adolescents. Adolescents also encounter mental health problems. They may become depressed, as I mentioned when I was discussing school health services with you. Adolescents could have mental health problems, one of which is depression. Recent studies have identified mental health problems, especially depression, as the largest cause of the burden of disease among young people. So depression is real, a real morbidity in adolescents. Other problems, health-related problems, include road traffic injury. They are aggressive sometimes, and it doesn't come as a surprise that road traffic injuries are part of the problems they have. Adolescents are noted for violent deaths and injuries. Some may also have iron deficiency anemia, especially adolescent girls, because of their monthly menses. Problems of obesity and nutritional disorders also abound, as we mentioned when we discussed school health services. In relation to risk, adolescents are characterized by great risk-taking behaviors and lifestyle. They are adventurous and they take risks. So the risks you find adolescents associated with include smoking, substance or drug abuse, alcoholism, unsafe sex, sexually transmitted infections. If you have unprotected sex, what do you expect but an unplanned pregnancy? And if the pregnancy is not wanted, what follows is unsafe abortion with its ramifications. Adolescents may be violent or may have aggressive behaviors, and this constitutes a risk in the life of the adolescents. There's also poor nutrition and obesity, some problems we encountered with school health children. Let's look at mortality or death. Morbidity and mortality rates for adolescents are relatively low overall. You may think that because they have many problems, because they are violent, because they are faced with injuries, their death rates will be high, but their death rates relatively are low. In 2015, for instance, approximately 1.3 million adolescents died, mainly from preventable or treatable causes. Road traffic injuries were the leading cause of death of adolescents in 2012. And it must be noted that about 330 adolescents die globally every day. Other causes of adolescent deaths include HIV/AIDS, suicide, lower respiratory tract infections, and interpersonal violence. It must be noted that throughout the world, there are about 49 births per 1,000 girls aged 15 to 19. So adolescents are giving birth. We're still looking at some facts about adolescents. HIV-related deaths are the number 2 cause of death among adolescents in the world. Problems they have, just like the school children we looked at in our previous session, problems of adolescents include depression, road injuries, and iron deficiency anemia. Other problems include anorexia nervosa and bulimia. Either they don't eat at all or they overeat till they vomit. Changes in adolescence. As we have said, rapid changes occur in adolescence, one of which is neurodevelopmental change. So adolescents face neurodevelopmental changes. And I would like you to go through the slides and read for yourselves what these changes involve. Other changes adolescents go through are psychological and social changes. Psychological and social changes. Do well to go through the slides to familiarize yourself with the details of the psychological and social changes adolescents encounter. What are the implications for health and behavior of all the changes adolescents go through? What are the implications for their health and behavior? Health problems in adolescents reflect both the biological changes of puberty and the social context in which these adolescents are growing. Health-related behaviors that arise during adolescence, students, have implications for public health. The changes that take place during adolescence suggest implications for health policies and programs. If adolescents are to be helped to live healthy lives, policies and programs must be in place to address their many health needs. Just like we said for the disabled, or people who are handicapped, or people who have an impairment of a kind, adolescents are vulnerable populations. Adolescent development really has implications for adolescent health. And I wish to inform you that to help address the problems of adolescents, there is one document in place, and this document is the Adolescent Reproductive Health Policy. In relation to adolescent health, safe motherhood services are available to cater for adolescents who find themselves pregnant. Pregnant adolescents are enjoined to make use of these services, that is, to go for antenatal services and to have skilled attendants at delivery. It is important that adolescents have access to information, including comprehensive sex education. Adolescents should also have access to sexual and reproductive health services. One problem health professionals particularly nurses, have with adolescents is that when they see these adolescents coming for services, they become judgmental. And these attitudes would drive the adolescents away from the services. So health professionals are enjoined not to be judgmental in their behaviors towards adolescents. It is important that when adolescents report for health services, we should make sure the environments in which we look after them are safe and supportive. As health workers, we need to respond to the special needs of pregnant adolescents. We shouldn't judge them, we shouldn't scold them, but rather respond to the needs they present. Skilled health workers are needed to provide their services. And health workers need to work with adolescents and respond to their special needs. I think I mentioned teen clinics and adolescent-friendly health facilities in our presentation of school health services. Now, let's look at some adolescent health problems. And they are similar to the problems we discussed for children of school-going age. You will realize that I have mentioned some of these problems already, but because adolescents are also school children, or some of them are school children, the problems they encounter are similar to what school children encounter. And these include, as I have mentioned earlier, injuries, trauma and violence, sexual and reproductive health, including HIV/AIDS, mental health, substance abuse, nutrition, and other communicable diseases. I have mentioned these a few times, and I believe by now you are conversant with the problems of adolescents. Adolescents have rights. Ladies and gentlemen, adolescents have rights. They have the right to health. They have the right to information. They have rights to health services and rights to privacy and confidentiality. When health professionals are judgmental to adolescents, sometimes they do it in the open, and that does not ensure the right to privacy and confidentiality. Reproductive and sexual health problems. Pregnant adolescents tend to have unsafe abortions, as I have mentioned, and unsafe abortion contribute to maternal deaths. About 16 million girls within the ages of 15 to 19 give birth every year, mostly in low and middle income countries. It's also been found that complications during pregnancy and childbirth are the second cause of death for 15 to 19-year-olds. These are all adolescents. It's been also identified that babies born to adolescent mothers face a higher risk of dying than those born to women aged 20 to 24, which means adolescent pregnancy is a problem of public health concern. In relation to health effects, pregnancy and childbirth complications cause of death among 15 to 19-year-olds globally, and this is worrying. With respect to economic and social consequences, it can be said that adolescent pregnancy can have negative and economic effects on girls, their families, and even their communities. So a pregnant adolescent can lead to negative social and economic effects, even on their communities. Girls who become pregnant usually drop out of school, so you would realize that prospects for a job becomes low. These are all some consequences of adolescent pregnancy. The WHO is doing something about these problems of adolescents. It published some guidelines in the year 2011. And these guidelines are for preventing early pregnancies and reducing poor reproductive outcomes. 6 main objectives have been outlined, and these include reducing marriage before the age of 18, which means adolescents are to be helped, they are to be given information and counseling so they delay marriage a bit. Creating understanding and support to reduce pregnancy before the age of 20. And then another objective is increasing the use of contraception by adolescents. Many people find it a problem dispensing contraceptives to adolescents. It is a debatable issue, but who in its response has come up with an objective that adolescents who are sexually active should be provided with contraception to prevent unintended pregnancies. Another objective by the WHO is to reduce coerced sex among adolescents. Reducing unsafe abortion among adolescents is another objective. And then the final objective is to increase the use of skilled antenatal, childbirth, and postnatal care among adolescents. Support for adolescent mothers. Families and communities need to support adolescent mothers. They may have made a mistake, but they need support rather than being judged. Adolescent mothers often lack knowledge. They lack education, experience, income, and power relative to older mothers. It is important, as I have reiterated, that we don't show judgmental attitudes to adolescents. We need to support them rather than judge them. Households and communities should support and accept pregnant adolescents. Research has shown that some adolescents who get pregnant are beaten and sacked from their homes. Some are not provided with food and what they need. It is better for us to support them and educate them to be wise next time. We need also to encourage the use of services and skilled birth attendants. Health services for adolescents come under preventive services, health promotion, and reproductive health services. As community health nurses, we have to make sure that where adolescents need preventive health services, they are provided with the service. Where they need health education and health promotion, we shouldn't deny them the information they need to be able to make informed choices. And we also should not deny adolescents reproductive health services. In summary, I would say that adolescence is a critical period in the lives of individuals. Adolescence is characterized by many complex and rapid changes that subject adolescents to stress and other health problems. We may think that because of their numerous problems, their death rates are high, but morbidity and mortality rates for adolescents are relatively low. Their health problems as a group or as an aggregate include unsafe sex, substance abuse, nutritional problems, and mental health problems. Students note that adolescents have a right. They have a right to health services, such as reproductive health service, among others. Thank you.